what is the success rate for IVF or in vitro fertilization? It is important to understand that the success rate of an IVF treatment depends on many variables. This could be based on your clinical circumstances or the cause of infertility why you need the treatment. Sometimes it can also be related to other factors such as the quality of the eggs, sperms and the embryos. It also depends on when we are replacing the embryos back or how many embryos we are replacing back. So looking at the initial factors or clinical factors, presence of medical illnesses, immune conditions, or other coexisting, or if you're taking any medications that has a potential to affect the quality of the eggs, then yes, that can affect your success rates as well. One of the most important determinants in the success rate of patients is the age, female age. So for success rates for the patients less than 35 on an average tends to be, for the clinical pregnancy rates would be around 40 to 50%. The live birth rates would be slightly lower. The success rates for patients between 38 to 42 drops to around 20 to 40%. And this again is the clinical pregnancy rates. Live birth rates have now improved at this group of patients, but it still continues to remain less than 30 or 35%. So patients more than 42, there is a significant drop in the clinical pregnancy rate and it tends to be less than 10%. So majority of the fertility specialists would advise considering the use of the egg donor if you happen to be more than 42. The success rates when using an egg donor was very comparable to what it would be for women who are less than 37. So it is with age, it is the egg quality that leads to the reduction in the clinical pregnancy rate or success of an IVF treatment as against the implantation of the embryo within the womb. When you are looking at the success rates of different clinics, it is important that you look at the clinic profile. What kind of patients they are treating. Every clinic has its niche area of working, or at least to a certain extent. And you should also then factor that into your cause of infertility. Are they treating enough patients of your cause, and whether that becomes the right clinic for you if you are chasing success rates. On the other hand, it's also important to know as to how the success rates are being represented, whether the denominator being used is a clinical pregnancy rate or whether the denominator is being used is a live birth rate. And when you do go for the consultation, it's important you ask your specialist is how recent the success rates are, because the IVF process is a dynamic kind of the treatment, and the success rates and the quality control processes in the clinic can change within a span of a couple of months. So it's important to know that the success rates are fairly recent for you to make an informed decision. At London IVF and Genetics, my success rates for patients who have been less than 35 for the clinical pregnancy rate has been 75% for the patients who went through the treatment in the last 1 year. So that is a kind of a guide mark. I still cannot be able to give you a live birth rates, but this is an indication for what you may expect if you are coming into treatment. Obviously, we tend to discuss in detail what variables may decrease your success rate, so have a realistic chance of what the expectations from the treatment should be. So really, in summary, where IVF success rates have considerably improved over the last few years, it depends on the factors, clinical factors, it depends on the stage of the embryo replacement, it depends on the number of the embryos that are being put back. So based on these factors, that will give you a better idea of the success rates to expect. It's also important to know you should not use these numbers as a very personal guide, because sometimes situations can change and success rates cannot always be replicated for every patient. Following consultation, are we able to give you a prognostic idea as to what your expectations should be with the treatment? Yes, it's absolutely true. That forms a large part of the consultation, because by the time we have information of your detailed clinical assessment, we have the results of your blood test and the scans and the semen analysis, and we are able to then bring together all these variables so that you have a realistic idea before you start the treatment. What we are very sensitive to the fact is that the journey of an IVF patient is anything but straightforward. It is rife with physical and emotional challenges that you go through. So it's very, very important that we take our responsibility in empowering you with the information so that you make an informed decision and set your expectations which are realistic.